Hi guys, so today we are going to talk about hepatic encephalopathy. So, hepatic encephalopathy is a reversible neuropsychiatric syndrome seen in acute or chronic liver failure. It is caused by accumulation of neurotoxins, mainly ammonia, in the blood and brain due to impaired liver detoxification. Now, it affects our consciousness, behavior, intellect, and neuromuscular function. So what happens is normally proteins are broken down into ammonia in intestine, and then our liver converts the ammonia into urea, which is then excreted out by kidneys. But in case of liver failure, liver cannot detoxify ammonia. Systemic shunting allows ammonia to bypass the liver. Now ammonia crosses the blood-brain barrier, and it converts the glutamate into glutamine, which causes cerebral edema. So, neurotransmission is disturbed, altered mental status is seen. So, what causes hepatic encephalopathy? So, its mainly primary causes are all liver related: liver cirrhosis, acute liver failure, chronic hepatitis, portal hypertension, portal systemic shunt. But the secondary causes, or we can also say them like precipitating factors, are GI bleeding, constipation, high protein diet, infection, dehydration, hypokalemia, sedatives or opioids, renal failure, etc. So what the secondary causes does is it's increase the ammonia level in our body, which makes it difficult to convert all the ammonia into urea. So the ammonia crosses the blood brain barrier and hence disturb our cognitive functions. So if we talk about the grading of hepatic encephalopathy, it's mainly starts from 0 to 4. So in grade 0, it's minimal and subtle cognitive changes are seen. In grade 1, mild confusion, sleep disturbance, and irritability is seen. Grade 2 is important because lethargy, disorientation, and a particular hysterexis is present. So, what is hysterexis? Is in this, the flapping tremor of hands are seen. We'll talk about it later on. In grade 3, marked confusion, stupor, incoherent speech is seen, and grade 4 is basically coma stage. So, what are the clinical manifestations like? If hepatic encephalopathy happens to you, what will be the signs of it? So, the early signs include sleep wake reversal, poor concentration, personality changes, irritability, forgetfulness. The progressive signs are disorientation, slurred speech, hysterexis. Again, it's flapping tremor of hands, ataxia. Ataxia is basically the lack of coordination or balance. The late signs are stupor, coma, decelerate posture, seizures, but seizures are like very rare. So let me explain you what is ataraxis. So ataraxis is involuntary jerky movement of hands. So when we extend our wrists, our hands are like flapping. Okay, so it is seen in the grade 2 as we have discussed earlier, but in grade 4, like in coma stage, obviously you won't see the ataraxis. So the diagnostic investigations now, it can be observed by you know finding the serum test, LFTs, INRPT test, serum albumin, serum ammonia, electrolyte imbalance, and the other test includes EEG. So the triphasic waves are seen in this case. CT MRI you can do to rule out any intracranial causes. Okay. Um, Now let's go to the management part of it. So uh, its management basically includes treating the precipitating causes or the secondary causes, which is control the GI bleeding, treat infection, correct electrolytes, relieve constipation, stop sedatives, and to relieve constipation we basically use lactulose, which is which so lactulose, what it does, it causes diarrhea, and the diarrhea is like it removes out the ammonia basically. uh, so the antibiotics used are rifaximin. It's a gut targeted antibiotic. It's neomycin or metronidazole. It is anti-protozoal or antibacterial. Now, diet management, it includes protein restriction in acute phase. Later on, more vegetables and proteins are preferred. In acute phase, basically, protein is restricted so that less amount of ammonia will be produced in our body. Okay. Now, the supportive care includes obviously to maintain airway if the patient is in coma, avoid sedatives, monitor mental status, and prevent any fall. Okay, guys, I think now we should talk about the complications. Um, Earlier we have already told it's cerebral edema, coma, respiratory failure, or in worst case, it can cause death. So, if since hepatic encephalopathy is reversible if we reduce the amount of ammonia in our body, it can be treated. So uh, as early as possible, if we can treat it, it will be uh, it will have like a good prognosis. But in advanced cirrhosis condition, the prognosis is really poor. So let's talk about the high yield exam questions. So most important toxin in hepatic encephalopathy is ammonia. Drug of choice is lactulose because osmotic, it's like a type of osmotic laxative which pulls water into the colon and acidifies our gut. Most common precipitating factor or the secondary cause is GI bleeding. Asterixis seen in which grade? It's seen in grade 2. Why protein restriction initially is important? It is important to reduce ammonia production. Why lactulose causes diarrhea? So,